Hello, my name is Miriam Taranirod,
And my name is Victoria Gomez.
and we did our research on advanced maternal age and pregnancy outcomes. So I'm going to begin with the introduction. So this study was performed to assess the relationship between advanced maternal age and adverse pregnancy outcomes. As we know, unfortunately, as maternal age increases, fertility decreases as well, causing an increased rate of spontaneous abortions. The hypothesis that they used was what is the association between advanced maternal age and severe maternal and perinatal outcomes. According to the article, women over the age of 35 have been known to represent a large portion of the population in countries with higher income. Therefore, the study wanted to focus specifically on populations that had a large number of advanced maternal ages to get a better insight on the pregnancy outcomes when compared to the younger maternal population. So for the methods, a multi-center cross-sectional study was used to determine the prevalence of maternal near-miss cases in a worldwide system of healthcare facilities. A total of 359 health settings were used in 29 different countries to evaluate pregnant women. The following countries were used: the Middle East, Africa, Asia, and Latin America. The women were classified into 4 of the following maternal age categories. So ages 20 to 34, 35 to 39, 40 to 44, and 45 years and older. The way the countries, provinces, and health facilities were chosen was by using a stratified multi-stage cluster sampling strategy. The adverse outcomes of the pregnancy were divided into perinatal and maternal outcomes. When conducting research on maternal outcomes, the following were included: maternal death, maternal near-miss, and severe maternal outcomes. When research on perinatal took place, the following was included: preterm birth, stillbirth, early neonatal mortality, perinatal mortality, low birth weight, and neonatal intensive care unit. Individual confounding factors were also taken into place, such as marital status, maternal education, and parity. Other characteristics that were used were onset of labor, fetal presentation, and mode of delivery. After collecting all the data, both age groups, 20 to 34 and 35 and over, were evaluated and compared using a multi-level, multivariate logistic regression model. Victoria is going to take over the results in the discussion.
All right. So for results, we have advanced maternal age was found to correlate with severe maternal adverse outcomes such as maternal near-miss, which is MNM, maternal death, which is abbreviated MD, and severe maternal outcomes, which is SMO. Advanced maternal age was also found to be significantly associated with a low birth weight. The severe maternal outcomes ratio was 5 to 1,000 live births in women ages 20 to 34, and up to 20 to 1,000 live births in women ages 45 and older. According to Lapbone, the rates for stillbirth and perinatal mortalities per 1,000 births total were 19 and 27 in women aged 30 to 34 years of age, and up to 43 and 53 in women ages 45 and older. The likelihood of preterm birth, neonatal mortality, low birth rate, NICU admissions, and APGAR scores of less than 7 at 5 minutes increases with advanced maternal age. The results supported the hypothesis that advanced maternal age significantly increases the risk of maternal adverse outcomes. The research did not point out, however, the need for further studies, but it did talk about past research done on complications of advanced age such as preeclampsia and placenta previa. It also mentioned how they were the only studies that looked at advanced maternal age, maternal death, and severe maternal outcomes in the multi-country analysis. Another factor to take into consideration was that the study didn't mention anything about C-sections and how that is a complication for pregnant women and deliveries. So we would have liked to see something on, the correlation between advanced maternal age and a possible need for C-section as opposed to a vaginal delivery. In terms of conclusion, the reason this article was chosen was to review because there is not enough education or research on maternal age as it correlates with pregnancy outcomes. Some of the strengths of the study is that it was all well organized and measurable. The data was interpreted nicely and with the use of visuals such as charts that made it much easier to understand their findings. We did also notice that the research used quantitative research methods, which was interesting because we are learning about that. The hypothesis was well written out and their sample size was a good one. The criteria for selection was clear and well thought out. The limitations we found was that the sample size was so large and it was a multi-country analysis. So they had a wide variety of people, a big population to look at. There are so many factors to consider such as education, eating habits, and prenatal care that could have potentially given different results. Also, there's a lot of data and information to keep up with when working with such a large amount of people. Overall, the study was easy to read and focused on the hypothesis, which is advanced maternal age leads to adverse pregnancy outcomes. And here is Marian.
Hello, hope you enjoyed our presentation. The reason we chose this topic, it was actually very interesting to us. For myself, I'm actually in my late 20s and I still don't have children, and I plan to have children in my 30s. At first, I would say that I want to have kids in my late 30s or mid 30s, but now after reading this and being more aware about the consequences, it makes me want to have kids earlier just to minimize the risks that come along with advanced maternal age. So yeah, this research is very...
It's pertinent to what you
yeah,
it's to heart too. I mean, pretty much women's lives is when it comes to having kids. But what I was also telling Mary, we just took OB last term, and then we learned about all these things like complications that can happen with deliveries and at birth. And I was just telling her, it was funny because we decided to do this topic after she's telling me about her desire to have kids in the future. I was telling her that my aunt actually she's how old is she? My mom's 39, so I think she's 47, and she actually ended up getting pregnant. It wasn't planned, and she had a child, my cousin, a little boy, and the little boy actually has Down syndrome, which is very surprising to me and to all of our family because it doesn't run in our family. A lot of my family members didn't even know what Down syndrome was or how this could have happened, but the doctor had no explanations. I mean, when she asked, why does this happen, or what could she have done to prevent it? There was nothing much the doctor could come up with besides, age is a big factor when it comes to complications and defects and so on kids. Of course, other things come into consideration, such as prenatal care, which she had. That was her third child, so she did have prenatal care. Eating habits were good. I mean, she felt like it was her fault, but there was nothing really much she could have done to prevent it, other than the fact that she didn't plan the pregnancy, and she did have him at what we consider in terms of we consider old and childbearing age. So I mean, that was an unfortunate event. It doesn't happen like that to everyone, as the study mentions. It's just a high risk. It's just a higher risk with higher age. So we just kind of would like to see more studies out there and more information out to women who do plan to have children in the future, that there is this potential complication for C-sections or placenta previa and a lot of other preeclampsia, a lot of other complications that can come with pregnancy. Not to say that something like that wouldn't happen to somebody that's 25 or 26, but you are at higher risk for developing one of these or having any of these complications with older age. So I hope you enjoyed our presentation, and we will be uploading this presentation as well as our citations with it. Thank you.
Thank
Have a good
you.
rest of your day.
Bye.